A warm welcome to all our viewers to our series Natural Medicine. Today, I was able to invite a university professor who's actually here today. It's none other than Professor Dr. Kurt Schicho. Welcome, dear Kurt. Hello, Alex. It's great that you're here again. You are a plastic surgeon, and first of all, I want to know, what is the difference between a plastic surgeon and a cosmetic surgeon? Yeah, that's actually a question that is asked very often. It's very often used synonymously because, as plastic surgeons, or as it's called, specialists in plastic, aesthetic and reconstructive surgery, we also carry out so-called cosmetic operations. On the other hand, however, the term cosmetic surgeon is not protected, which means that it can very well be the doctors who have only trained in seminars, in weekend courses, and maybe inject hyaluronic acid or do minor beauty procedures, call themselves a cosmetic surgeon. But that does not mean they've completed 6 years of specialist training in plastic surgery. So it's often used synonymously, but of course there's a big difference. A specialist in plastic, aesthetic and reconstructive surgery, that is a full 6-year residency. And cosmetic surgeon is actually not a protected term. Any doctor can do that, inject hyaluronic acid and make any aesthetic changes. Of course, it is mandatory for what you do, no matter what subject. You have to have and prove your qualifications, of course. Just the fact that somewhere it says cosmetic surgeon doesn't mean that this is a board-certified plastic surgeon. I've read in the newspapers now especially with many people in home office and now that people are all at home, that surgery or cosmetic surgery on the face area at the moment is extremely popular. Yeah, it seems to be the case. I can only say and observe it for the European area at a time like now that we're forced to wear masks and to be in the home office a lot and restrict our social contacts, social life, that it may not be the cause that many people want to have such procedures performed. But they think if we do the surgery at some point, now is a good time. Because in the healing phase, where you might still be swollen, where you might not be quite fit, not quite ready to face people, you can hide it better. So if you do it now, in the winter time, which is a popular time for such operations anyway, and then when you go shopping, anyway, only to the grocery store, unfortunately everything else is closed anyway, masks are compulsory and you can sit in the home office, you can have no social life, but then you can actually do these operations very inconspicuously. Do you have a feeling how it has developed in recent years? The willingness to change your own appearance? I think the willingness to do these interventions is not so much observed, but rather dealing with it. So, a long time ago, this is what older colleagues tell me, it was almost a taboo subject. So, some people sneak to the plastic surgeon, like, hopefully no one will see me again there, while today the trend is more that people talk about it with friends. I did this or that, who can you recommend? Something bothers me, some supposed or actual flaw. Where can this be fixed? I immediately agree. If the psyche is really badly affected. But what do you think? I think man is perfect just the way he is, and I always have the feeling that these plastic surgeons have to bring more and more people into a norm, an ideal of beauty, which is actually only somehow portrayed like this via the media. Yeah, of course, it's often in the hands of the media, how it is portrayed and sensationally presented. My approach is more, so I'm speaking for myself now and not for the entire stand, but I like to emphasise the reconstructive surgery part. And this means cosmetic surgeon, that's something I tend to avoid. Of course, you always try to make everything as beautiful as possible, but when you say cosmetic surgeon, it's often associated with things that you have just mentioned, which are not necessarily positive. So the feeling of having to conform to some norm set by the media, by advertising. In contrast, I see my role primarily as a reconstructive surgeon, things that have been lost, be it through an accident, be it through the aging process, simply regaining what you once had. I think it's a really nice idea in all areas. This applies to health, the body, as well as the economy. Most of the time, it's harder for people to bear losing something than not having something. So, if you, for example, I do a lot of hair transplants. Lose hair. I used to have hair, now I don't have it anymore. Or same thing for dentists. You lose a tooth in an accident, suddenly there's a tooth gap. That bothers you. Something, or replantation, is also part of plastic surgery. Losing any part of a limb is far more dramatic and distressing than not having anything. And here, I see the role of plastic, aesthetic, reconstructive surgery, for me personally, in the foreground, to restore things that you had as best and as naturally as possible. So don't put people in any mould that the media suggests. You have to look like this to meet society's expectations. That's totally wrong. And there, I also try to discourage people that come to me with such expectations. And I tell them, please, think again. What's the motivation? Why are you doing it? And when someone comes and says, I've lost something, I'm bothered by some sign of age, some wrinkle which has dug deep into the face, the chest, the elasticity, or for example, people who've done something good for their health. Exercise, a conscious diet to reduce body weight and reduce it very much, who at some point say, I'm now putting an end to my unhealthy life, I'm reducing my body weight back to an ideal, healthy weight, and then I have problem areas. I have a pendulous abdomen, the skin simply loose. What can you do about it? Let's fix this. And this is where I actually see my role. So very gallant, so good. But allow me to go into the question again. The people who really have to conform to some kind of norm, is this clarified mentally, psychologically, whether that really is a necessary operation, or can anyone do it? So, there is a difference between necessary operations and unnecessary operations. So, aesthetic operations, one says medically indicated or with aesthetic indication. The clarification is not only important and necessary, but also required by law. That is the question whether patients may have a psychological problem in the background, or believe they have to respond to social pressure. It's very important for us plastic surgeons to explore in the first consultation, where is the motivation? Do the patients actually have an understandable concern? Can we, and this is also very important, can we realistically meet the expectations of the patients, or at least come close? Now, if I say I want to look like George Clooney, it's not a question of money, it won't work. So it's very important to see if the patients have realistic expectations. And are we able to live up to these expectations and clarify what is possible and what makes sense here in a serious manner? Then let's go into the practice, and I'll just take breast operations as a topic. I imagine there is breast reduction surgery, breast augmentation surgery, and of course what's really the restoration, which is people who really had breast surgery. It's been removed, for example, and well, now it's being rebuilt, which is again an incredibly great thing, that the woman says she can feel like a woman again. I think that's something great. It's not about that for me at all, but rather the enlargements and reductions. Is this something that is done frequently? It's really extremely common. It's really day-to-day business. Although you said that it's more in the background, I can confirm that it's in the background in the media, this recovery, the reconstruction in breast cancer patients. And that is an activity that I appreciate very much, because I believe that in regards to karma and from an ethical point of view, It's something very, very valuable. And just as we've discussed in the introduction, namely to return something that one has lost, apart from the drama of the cancer itself, it's a terrible situation for the female patients, apart from the fear of life and the whole burden, which are bad enough already, and then the situation of losing the breast, which stands for femininity, even if you can partially hide it with clothes. But that is incredibly important for the overall well-being, for the entire life of women. There are also established methods of how to restore it. Well, a woman shouldn't just be limited to her breasts. It's much, much more. But I know what you mean. Oh, this is a very complex operation. You can bring the back muscle forward under the armpit and rebuild the breast from it. You can take the abdominal muscle and put one up here and hook it up. But tell me, can you see anything at the end? Yeah, you can see something, that there was an operation, but one can greatly improve the situation. So afterwards you have a breast again. Absolutely, their own tissue. And what do you see then? Well, scars are of course unavoidable with every operation, depending on the operation, larger or smaller scars. And that brings me actually to the next topic that you asked about. But it's important for me to go into that briefly, because the media often talk about breast augmentation of celebrities, or today a situation that I personally don't like, the role of influencers. So various social media accounts tanned at some beach club, that simply conveys a picture of life that actually arouses maybe feelings of envy in the viewers, maybe also feelings of being in a disadvantaged role, even if what the influencers sometimes convey is not a realistic picture at all, and also only superficial, actually only a facade. And I find that pressure is exerted here. And then patients believe that we also have to look like this or come close to that. I think that's a completely wrong approach, so I'm trying to slow it down. And for these reasons, such topics are very much in the foreground in the media. Breast cancer patients tend to be underrepresented because it's a topic that is covered on social media, maybe only in laudable, exceptional cases. But as you say, also, as beauty interventions, breast augmentation, breast reduction are very, very common. And here too one must restrict that breast reduction in particular. It is very, very often not a pure beauty intervention, but actually on the contrary, very often covered by the health insurance companies in Austria, because when the breasts are noticeably large, patients, well, they don't have any optical considerations in the foreground, but are restricted in their physical activity. They want to lead a sporty life. They want to be active. They want to run, ride horseback, ski, do gymnastics, whatever, but feel, especially in the warm season, impaired in their physical activity because of the oversized breasts. So, when you do sports and sweat, the skin underneath is irritated, which can lead to serious skin problems. And as you mentioned, it can cause pain. Problems with the musculoskeletal system, tension headaches, and can actually go as far as migraines. It can cause lower back pain. So, these are situations where one no longer speaks of a beauty procedure, but it also has a medical indication. I already suspected that. And also with the augmentations we have, and these are also topics that are hardly present in the media, much less than influencers who now have their breasts enlarged, as is often imagined in a cliched way. Some of these are young women who suffer terribly from the fact that after or during puberty, it turns out that one of the breasts has a so-called tubular deformity, for example. That, for example, one breast develops normally and the other breast, as one might now put it vividly, has a tubular shape, is more or less deformed by a disturbance in growth and is completely asymmetrical. And the young women are then in a situation where they feel ashamed to go to the swimming pool with their girlfriends as normal. They don't dare go to the gym, they somehow have the feeling that I can't go to buy normal clothes now, but hopefully no one sees this, hopefully no one notices. And I don't really want to talk about cosmetic surgery here. Now, of course, the goal is to make it beautiful afterwards, but when we talk about cosmetic surgery, then it often has this connotation, like this influencer who poses somewhere here very superficially, not intellectually, and then post the photo on social media. No content, nothing in the head, and huge breasts. That's how it's often portrayed. And I think women, especially those who are actually having a growth disorder in the breast up to having no breast at all, and then going to the plastic surgeon saying, I just want to be perceived as a woman and to have a body that doesn't conform to any norms now, but simply I just want to feel like a woman, not to post anything unrealistic on social media now. And to give that back here, I think that's absolutely okay, also ethically. I agree. I recently read, though, for example, in Brazil, 80% of all women have undergone breast surgery. And fathers already give the 11-year-old daughter a breast augmentation. But that's the way it is in Brazil today. And I just think this trend is somehow not normal. Well, I'm with you 100%. That's also something that myself, and also I don't want to generalise, I can't speak for others, but all colleagues I know, and have gotten to know in the course of my career, if such a situation would arise that an 11-year-old would come along and got it as a birthday present, I don't know anyone who would do that here. So these are really dubious cosmetic surgeons. I mean, different countries have maybe a different mentality and different approach to it, but I'm speaking now for Germany, Austria, Switzerland, where I have a certain overview and I know a lot of colleagues. And nobody would do a breast augmentation now for a teenager who got a voucher for her birthday. Very much a correction of a real deformity, which makes suffering understandable. But the other thing is very often a psychological problem, and that's just, as already said, not only important, but also required by law. To clarify this very carefully, to research it very carefully, whether there is a psychological problem behind it. And if so, then before even considering doing anything surgically, a psychological evaluation is arranged. And any conscientious plastic surgeon will do that and will not consider anything else. And a cosmetic surgeon doesn't have to clarify that. Of course. So the regulations are, of course, very clear. It's about the professional license, the implementation of real cosmetic surgery. So operations that are not medically necessary but just pure cosmetic operations are allowed, according to the law, to be done only by a specialist in plastic, aesthetic and restorative surgery all over the body. There are, of course, exceptions. For example, an ear, nose and throat specialist can, of course, make ear corrections or for aesthetic reasons. An oral and maxillofacial surgeon, of course, can do corrections in the face. A gynecologist can perform breast corrections. This is also covered, but in principle, detached from a body region, cosmetic procedures on the entire body, so real operations, are reserved for the specialist in plastic, aesthetic and reconstructive surgery. Very often, of course, it is said, no plaintiff, no judge, but very often for a cosmetic surgeon, I'll put it like this, if it says cosmetic surgeon somewhere, one is often called that by the media, me too. Often the media write, the cosmetic surgeon, and if it's not meant in a negative way and it's not meant in the sense that this is the one that enlarges the boobs of teenagers, then I won't complain about it. But when you say cosmetic surgeon in the sense that you also do aesthetic interventions, then I think that's fine. But I would just give the viewers a message. If it says cosmetic surgeon, then to ask, is it actually a specialist in plastic, aesthetic and reconstructive surgery? Great. Now, you said earlier that a lot of operations are especially for women with very large breasts. Is there a tendency for breasts to get bigger? I have the feeling that 30 or 40 years ago it was much smaller than it is today. This period overview, so 40 years ago. Your youth, for example. So I didn't just judge the female acquaintances by their outward appearance, and also I also worked as a reporter for a long time. I was your colleague as a reporter before I became a surgeon. And, well, I have to say, in the interviews where I was actually in this bling-bling society and in crowd and things like that, I was a society reporter, also in broadcasting and radio, so I've always had something to do with it. And I have to say that even at this time it's my individual approach again. I preferred if they were women who were intellectually interesting and maybe they were artists, actresses, musicians, that was much more interesting for me. Believe me or not, it's possible that many in the audience behind the televisions will say, no, we don't believe that. You can see my nose is not getting longer like Pinocchio's. It's really like that. I didn't look primarily at the breast during this time. I just have the feeling that everything is just growing more and more, and I don't know why. Whether that's also something to do with hormones in the water, with meat, whether it promotes growth, or whether the children simply become women much earlier. That this puberty age is simply reduced for women. I wouldn't go that far, Alex. I would say if you look at 200, 300-year-old buildings, or local history museums, the doors were lower there too. Statistically speaking, people are generally getting taller, but that there is now a trend of having bigger and bigger breasts. I couldn't say that. Breast augmentation, that would be a topic that I would like to mention very briefly, because it's often been in the media in recent years. That the breast implants sometimes had a very dubious reputation. In France, so many have burst. Yeah, exactly. That was somewhere the initial spark, or one of the main factors that contributed to the massive tightening of regulations for medical devices for CE certifications. In the European Union, all of Europe, Switzerland too, of course, the conditions for bringing a medical device onto the market, specifically to certify a breast implant so that you can implant it, then became massively tightened. That means the products that are implanted here, the breast implants, are really safe. Of course, you have to tell the patient a foreign body is and remains a foreign body. Only even if it leaks, which is rather improbable and actually can really only happen in extremely rare cases. But then today, with today's products, with the approved products that are used, it's not like it sometimes happened in the past, that you then fill the hollow in your chest with some horrible poisonous stuff and that it might burst or leak. So this danger is it's completely absurd. Everywhere, or just within Austria, Germany, Switzerland. If someone goes to Turkey, I don't want to talk negatively about other countries now. I don't know the situation there. I know from congresses as a university professor, I was very often at congresses before the Corona period. Unfortunately, very limited now. There are excellent colleagues everywhere, excellent surgeons, so I don't want to differentiate now. As I said, every reputable plastic surgeon, no matter in which country, checks which products they install. Now, there are, of course, black sheep, but today the products that are used from all well-known manufacturers are really safe. That means you don't need to be afraid of doing the wrong movement or exercising, or perhaps exerting too much pressure when you fall or something, that it bursts and something happens. But shouldn't someone find out which implant they're getting? It's mandatory, of course, to also give an implant card. You always get an ID card, and every reputable surgeon will, of course, explain it, whereby from the well-known branded products, there are none which are unsafe now. There is, or that would go too far in time. We're already far advanced in time, but of course, you have to make every planning of an operation very individual. So look at the patient in question. What ideas does the patient have? And then choose the implants. There are, of course, no implants in the European Union and Switzerland today that are dangerous in that sense. Well, that's good to know and to hear, because I'd like to tackle the topic of both Botox in another program, whether this is really poison or not. Now, I'd like to ask, if someone is going to have a breast operation, what does the healing process actually look like? How quickly or how do you optimize that the whole wound heals as quickly as possible? Well, the healing, of course, you have to see the past of the patients, male or female. Men do breast surgeries too. Tightening. What? Men do too. It bothers a lot of people that the male breast, even if you're not overweight, that this is corrected. Of course, you don't need an implant for that. It's also done very often. This is a so-called gynecomastia, which is corrected. But to come back to the implants and the healing, the chest is actually a region of the body where wound healing is typically more difficult than, for example, in the face. Typically, wound healing is less problematic on the face than on the chest. One can, of course, really support the wound healing, first of all by eating healthy food, if you pay attention to a balanced diet. And what we do very strongly, which unfortunately is still not widespread enough, but what I routinely use is this pulsating cold red light. We also had research collaborations with the Repulse company, and still have, the only manufacturer of truly CE certified medical products in Europe, that we have here with this light, which is completely unproblematic. You irradiate the breasts or wherever you operated almost immediately after the operation, then once a day for 12 minutes. But now when we talk about the breasts, you irradiate them. It's extremely intense. Red light, cold red light. It penetrates deep into the tissue, reduces swelling, reduces bruising. So you don't say hematoma, it's actually ecchymosis. It's simply the blue discoloration of the skin. Optimizes the scars, because if the wound healing is better, faster, and unproblematic, then the scars will also be nicer, and the pain's reduced. And these are things that you don't just have to believe, which are not alternative, complementary, or anything, but are documented mechanisms backed by reputable, randomized, controlled trials. How to gently optimize wound healing. And I do this in these so-called cosmetic surgeries routinely, because it's all the more important for planned surgeries for cosmetic purposes to bring the patients back to everyday life as quickly and comfortably as possible. Sure. Now, I've one more question, but again to this. I know the manufacturer, and she told me in 2021 the health insurance companies in Austria actually decided that the device is paid for by the health insurance company. That's crazy. In a beauty operation, so in a purely cosmetic operation, of course, the health insurance does not step in, but in the case of a breast tightening, for example, which is covered by health insurance for medical reasons, or in all other areas, chronic wounds, we're going to talk about that, the light application, because it is actually a recognized therapy, is something the insurance takes care of. Well, that's amazing. You're right about that. Austrians are much further along. No, because you think it's worth mentioning, it's true that with the health insurance is not yet across the board, but some word got around, and that, unfortunately, well, I'll say it casually, it sometimes takes a bit of elbowing to secure this right of assumption of cost. But a healing treatment, which has been proven to work, that's what I'm really emphasizing, that's not alternative, complementary, esoteric, or luxury that you have to afford yourself, but that is a healing treatment, which has been proven in randomized controlled trials, the cold red light, which also avoids the side effects of medication, and thus is a recognized healing treatment with a CE-certified medical device. It's something the insurances take care of. Unfortunately, sometimes you still have to fight for your rights. Good, but it's unbelievable what chances the Austrians have in this respect. In Switzerland and Germany, this isn't the case yet. So the last question, roughly as a rule of thumb, what do you actually have to expect for such a cosmetic surgery on the breast? Or plastic surgery? Well, that is, of course, extremely different, and above all from country to country, because the price level and income level are different. Because you have a very large geographical distribution as a broadcast, I want to be very careful here, because you differentiate there. If you ask me how much does a cup of coffee cost in Italy, it's different than in Zurich. And that's why it varies from country to country, but I would really say be wary of extreme surgery offers. Extremely expensive does not necessarily mean better. Well, expensive does not always mean good, but I think when you do an operation like this, you prepare for it. And it's always very, very important to me that my patients ask lots of questions. That means finding out beforehand. And then you get an overview very, very quickly if you just go online. And with it, if there are any cheap package deals, if something only costs a third of what it costs in Austria or in Switzerland and flight and hotel are included and so on, then it might make sense to inquire a little bit more precisely. But basically just find out more, get a few offers and then talk to the therapist you trust very specifically about it. What does it cost? Every reputable therapist says that at the beginning. And for me, myself as a person, I'm very well on average. I'm moderate there. I'm in a rural region with my surgery, so in Carinthia. So there I am certainly fairly moderate with my prices. Although I also often perform surgeries in Vienna when people fly in from abroad. I also operate them in Vienna. Reconstructive surgery, that's a health insurance issue. In general, health insurance covers that except if someone wants to be in a private clinic due to the amenities of the hotel component. You see, dear viewers, I still have 1,000 questions, but I really have to stop now. But I do more shows with him because Botox, in particular, or this Brazilian butt, lip enhancements, there are so many topics that I just want to have documented with an expert. And if Professor Kurt Schicho is already here, then of course I have to seize this opportunity. I hope you found it interesting to listen to the show as well. I wish you all the best. Thanks for watching. See you next time.